Welcome back to Inspire Great Health. I'm your host, Bridget Wilson, and I have Dr. John Schallenkamp from our Cancer Center today. How are you doing today, Dr. Schallenkamp?
Doing great.
Great. Thank you so much for joining me today.
Yeah, you're welcome.
So we're going to be talking about cancer and cancer prevention. But we're going to start by having you introduce yourself. Go ahead and tell me a little bit about yourself and what brought you to Cheyenne Regional.
Yeah. Well, so I'm John Schallenkamp. I'm a radiation oncologist. Did my training at Mayo Clinic some years back and grew up in this region. I actually grew up in Denver, so there was always a desire to kind of come back to the region. And so I spent about 20 years up in Billings and established the radiation oncology practice there. Had some really good people. We did great. At this point, kids get older, everyone moves on. It's just us and the dogs. And you sort of transition your life a little bit, right? You take care of your own family, and then you got to think about going back to how are your parents doing. So we got a little focus on our parents. And I've always known some of the group down at the University of Colorado, and actually they're trying to support a lot of the cancer work going on up here in Cheyenne. And so I moved on and worked with them, and this was actually a great match. So I'm an associate professor at the CU Anschutz School of Medicine and Radiation Oncology, and now I'm the radiation oncology medical director here at Cheyenne Regional Medical Center. So a lot of words, but it's fun. It's a great group.
Oh, good. Well, I'm glad you enjoy it.
Yeah.
For our patients, what would you tell someone who is recently diagnosed with cancer? We know that is a very difficult diagnosis to receive. How do you handle those patients and help them through it?
Yeah, I think it makes a lot of sense because, I don't want this. Like, nobody wants to hear that cancer word for sure. That being said, a lot of us will. Therefore, what I tell everyone is, let's just make sure we answer all the questions. We have a plan. I guess what I would emphasize is that the vast majority of cancer can be managed very well. All right, so let's not necessarily freeze it. Let's get involved with your cancer care team. Let's talk with you. Let me hear about you. Let me hear about the things that you value. Let me hear the things that have you concerned the most. Let's get those addressed. That's one of the ways we try and personalize things a little bit, because there's always, what's the best practice, and we'll get to that. We'll get to the point of what's the best known way to manage someone's cancer, but knowing a bit more about the things that people value the most and what they really are worried about. Some people are worried about this, and some people are worried about this. So let's just get all that up front. So number one is really just engage with your team and let us engage with you, and let's make sure we're here about those things. The second thing is, again, let's make sure we know that most cancers have an actual treatment, and the fact that the science is changing so rapidly. Things that some years ago, I wouldn't have had a treatment for this cancer or that cancer. These days, it's incredible what has been done. Just for example, melanoma. So malignant melanoma, a lot of, skin cancer that can be very aggressive. Back in my days when I was training, there was not a whole lot that could be done for that. These days, it's like, wow, we have fantastic treatments that are shockingly good, is what I would say, from a cancer provider standpoint. From a patient standpoint, I just want people to make sure they keep hope, and not necessarily think the worst. There's surprisingly good treatments out there.
Well, I love that you want your patients to keep hope, and I love that you inspire them to do that. So I appreciate what you do.
Right.
And in our region, in a rural region, late diagnoses can be quite common. Is that an issue that you found in our region?
Yeah, I would agree with that. Rural care has its own challenges, and you can really think about it from the beginning of any healthcare journey and then just go stepwise through it. And almost every one of those steps, there's a particular thing for the rural communities that are challenging, right? So for instance, do we even have access to healthcare? Right? I mean, whether it's do you have access to primary care or do you have access to specialty care? All of those are challenges that are real. And then once you have, perhaps you either do or don't have access, but regardless of if you have access or not, sometimes people in the rural setting, just getting to the provider's office can be a challenge. I mean, whether it's Montana or Wyoming, it's not at all surprising if people are traveling 100, 150 miles or so just to see their provider, just to get the appropriate test performed. You know, so distance and geography, it's a real challenge. And sometimes that stuff goes overlooked, you know, whether it's, you know, a lot of the research might be done in big cities, et cetera, where there's, you know, clinics and hospitals almost on every corner. That is not the case out here. I think sometimes there's a challenge, depending on the community also, with, you know, if you don't see the doctor, if that just isn't a thing, you know, and that's, maybe that has been a, you know, community challenge or whatnot. And some of the aspects of healthcare just kind of go by the wayside. You forget about screening. You forget about, you know, getting labs checked. Maybe you do or don't have someone who's kind of on your side. And that's sort of how I think about, you know, the importance of primary care, for instance, is they are folks that are on your side. They are advocating for you. Mm-hmm. You're trying to get your labs, trying to get your screening, you know, trying to really kind of keep control. So those challenges can translate into people who historically might not be able to get to the doctor and then presenting later than people otherwise who have access, right? So, you know, for instance, years ago, before we have this test or that screening test or that screening test, sometimes the only, you know, the only time people present is when they are in so much pain that they thought would go away. Mm-hmm. So we want to stay away from that best we can and really just, you know, get a sense for what things might develop in a certain population, whether it's your age group or whatnot. Screening tests help tremendously and help us get into that world. If we do find a cancer, the majority of them can be cured. You really got to think about that.
And is that why early detection and screenings are so important, just to catch it as early as possible?
Yeah, absolutely. Again, I sort of emphasize this point because I think over many years I've heard patients, you know, and family members, et cetera, who don't necessarily hear that cancer can be cured. I hear a lot oftentimes, well, it never goes away. I don't think the data pans out, actually, and actually many of these cancers, especially when they're found early, are curable. Screening tests are great because in the setting where something might show up very late, very often, in which case they are very difficult to cure or manage, if you have a screening test and we find something very early, very often we can get rid of them. So another piece, I think, I want people to try and maintain a bit of hope and a little bit of optimism and positivity. Cancer isn't necessarily always terrible. Nobody wants it. I agree with that 100%. But let's do the very best we can for people.
Yes, absolutely. Yeah. And what screenings should not be skipped, if any?
Let's see. Yes, none of them.
None of them. Okay.
No, honestly, and you know, a good screening test has to meet, you know, certain criteria. You know, is it cost effective? You know, can it be implemented? Can it, you know, come to the communities? And does it actually translate into finding a cancer, you know, very early or even pre-cancer lesions? So, for instance, the one that's, I would say, you know, very difficult sometimes for people to wrap their heads around, the colonoscopy. And that's a tough one, right? It just is. Let's just be honest. Yeah. However, it's undoubtedly one of the best ways to find pre-cancer lesions and get rid of them before they become cancer. So screening, basically all the screening tests that are available today are very valuable. They help us find cancers and pre-cancer lesions before they become untreatable, frankly. And Part of the criteria of a screening test being an actual screening test is the fact that it can translate into that improvement, so it can be cured. Certainly colonoscopy, I would say, is one that in this region, whether it's, Wyoming or Montana and a lot of rural areas, that's a challenge on one hand, because people don't necessarily like that idea, number one. However, the data over many decades is clear. It helps cure cancers before they even start very often. It goes back a little bit earlier. You had asked about some of the challenges in the rural area. This highlights a little bit of that in a couple of ways. One is, again, where's the access? Are we stuffed to the rafters with gastroenterologists? We're not. In fact, there aren't many places that are. So part of it's access, but I would say, if people talk to their primary care providers, just tell them, listen, I think I might be due. Just those words help your doctor really sort of help you get set up. And even the little test kits that are now there, the immunoassays, the fecal occult blood testing, those are actually very useful. But again, in this region, this is a test that's underutilized, and we have much higher rates of colon cancers than other parts of the nation.
Our region does?
Our region does. So that's a question. We got to really think about that. Certainly the other tests, mammography, it has been a home run over many decades. We find so many breast cancers so early that they are curable. Again, I want people to maybe, if they've heard from people, well, it never goes away, it's not true. There are many cancers that are completely cured, and mammography does a fantastic job. The newest one on the block has been around for some time, but it's still kind of new, is the low-dose CAT scans for lung cancer screening. So it's just, people might meet certain criteria. Maybe they smoked a long time in the past, or maybe they continue to do so. You do not want lung cancer. Everyone knows that. There are pretty good treatments. But these days, if you have that screening test and we find these nodules and these cancers early, they're stage 1, you have a variety of options. And these are curative intent treatments that weren't really there, 15 years ago. We could go on. There's a bunch of them. Now, of course, the Holy Grail is the one that I'm asked about a lot from patients is, can't you just take my blood and see if I have any cancer? Not yet. I would say years ago that was a never is going to happen, and now it's like, yeah, actually there's a lot of companies working on that stuff right now. Not quite there. Maybe in my lifetime, maybe in a lifetime, we'll get there. Got to validate all those tests and things. But that's very interesting stuff. It's on the horizon, but don't wait for that.
Yeah.
Do the screening tests that are available now. Get those cancers. If they're there, just let's find them. Find your doctor, find your team. Let's cure them, and let's move on.
And that all leads me to my next question. What would you say to someone who is scared to go in and get a screening because they're afraid it's going to be positive?
Yeah. Well, that's a good question, and I think that's very understandable. I think people need to at least, hopefully, maybe that's of some value. Please understand from the doctor's standpoint, if you're afraid to go in, that makes sense. Like 100%, it makes sense. I get it. Now, that being said, if you could get that test done and it comes back negative, phew, okay, great. Then you've done it. You've been through it. Fantastic. You're a pro at it at that point. You think you know how to do it. If it's positive, thank goodness you did it. It's basically a win-win. So I get it. I 100%. I understand, and but it kind of goes back to that point. I think I've been talking about a little. I want people to maintain some level of optimism, have a little bit of hope, have some optimism. Honestly, we cure a lot of cancers these days, and the ones where I can really stack up all the wins are the ones that we find with screening. So I would strongly encourage. I acknowledge the fact that it can be scary. Talk to your doctor, talk to your primary care provider, the person who's helping you with that test. If you have questions or concerns, ask them. Write them down. I tell people all the time. In the middle of the night, you're going to be waking up. Maybe you might have some questions. write them out, every single one of them. And I say, just bring them all in. We'll go through them one at a time and make sure we get them answered.
If a patient has a late stage diagnosis, what would you say to that patient? You said, have some optimism. Even at a late stage diagnosis, is there still some optimism to be had?
I would say so. Again, I would emphasize the fact that science is moving so rapidly these days. Things that might be a higher, later stage, scarier situation. Let's work through that piece. And then let's lean into the side, okay, where's the science right now? What's the very best option for you, that patient? And that might either be, here we're going to show you, this is the data, this is where the best practice is right now. And the nice thing about a location like Cheyenne Regional Medical Center is they're very kind of leaned into innovation right now. So it's, that's what, this sort of partnership you think of the University of Colorado and Cheyenne, they get very, very caring people that want that community to do excellently and bring innovation here. So I'm very excited about that. The medical oncology team, the surgeons here, the radiation oncology team, they're excellent. They're very focused on their patients. So that's already a win. So even with a later stage diagnosis, we can sort of lean into, what clinical trials are available, and those are available. Some of those are going to be available right here in Cheyenne, and if we need something extra fancy, or there's a trial available for someone with laser, we can get them in wherever we need to. So trial work can also be kind of scary for folks. I would just sort of acknowledge that first. Like the classic language, and I get it, I want to understand this, is, placebos and guinea pigs. Like people talk about placebos and guinea pigs. Like I'm not going to get any treatment at all. It's not true. So we should talk about those, and I would encourage people to really kind of walk through that with their provider. Some of the clinical trial work we do, whether it's lung cancer or prostate cancer, some of those questions are about efficiency. Can we do treatment more efficiency? Can we do it with fewer side effects? Can we do it that's less costly? Can we do it and add a new medication that's just been approved, right? And prove that we're gaining improvement in the actual treatment itself and the patients and how they feel. It's very exciting stuff. And I think people just need to be aware that that is available to them. You don't have to do it. We might have 2 or 3 trials that are perfect for people. They don't have to do it, but I do think you should be aware of that. Yeah. Kind of nice to know all of your options.
Absolutely. Well, those are all the questions I have for you. Is there anything else that you would like to add?
Well, I guess what I would add maybe is just to reemphasize the fact I've been doing this a long time. So have these providers in Cheyenne and down in Colorado. It's very much the case. The questions you've asked, I think, are very important. Cancer can be paralyzing, right? It can stop people from being treated. It can stop people from getting screened. And again, I don't blame anyone for those feelings. It's daunting, especially when my grandmother, my mom, my dad, my friend, they did their treatment so many years ago, and it was devastating. Again, I think the people in our situation would acknowledge that sometimes, while things don't go perfectly for patients, we still want people to have the actual very best. The strides in the science and the cancer care have really been focused on patients, their outcomes, how they feel, how they tolerate the treatment. And so it's less toxic. It's less some of that stuff you may have heard, over decades. And frankly, having your own knowledge base that you write those questions down. You come in with any skepticism. I think that's completely open to that. Let's talk about everything so you can be fully engaged, fully aware of your options, fully aware of that diagnosis and what can be done. Because then you're in charge. You should feel as educated as possible, and then we will follow your lead, right? Because basically you're in charge. We're going to give you this. However you want to proceed, we will support.
Excellent. I think that's an excellent way, care philosophy to have.
Absolutely.
Well, thank you so much, Dr. Schallenkamp. I appreciate you joining me today.
Thank you very much.
Thank you. And thank you for joining us. Please tune in next time.